So your little guy's going to be homeschooled now? Is that what they're announcing?
Call the meeting to order. We'll begin with the Pledge of Allegiance. I invite you to join us.
Pledge allegiance.
Roll call, please.
Gehrig?
Here.
Pepcorn?
Here.
Preston? Here. Strand?
Here.
Mahoney?
Here. Fargo Cast Public Health reminds the community of the importance of receiving the flu vaccine this year. Because of COVID-19, reducing the spread of respiratory illness like the flu is especially important this fall and winter. The CDC recommends getting the flu vaccine in September or October, but getting the vaccine anytime during the flu season will help to protect you. This is good news. The library, what a great place. As of October 1st, the Fargo Public Library will no longer charge late fees or fines on materials. This change increases the equitable access to materials, resources, and services for all our residents. For many, overdue fines and late fees are a barrier that stops them from accessing and benefiting from the variety of resources the Fargo Public Library offers. With this initiative, the library hopes to increase access to books and reading, boost literacy, and remove barriers for all ages. The library will continue to charge fees for lost, missing, or damaged items. Also, the downtown main library has a mask tree in the lobby, and library staff are accepting new handmade masks of any size for the tree to provide masks to the members of the community who need one most. Donated masks could be dropped off as the main library circulation desk as well. The deadline to complete the 2020 census is September 30th. Planning staff will have an update of this topic later on this agenda. There is a press release about the census posted on the city website. It's important for us for getting federal funding to really ask everybody to participate. On September 14, four firefighters left Fargo to assist with the wildfires in Oregon with a fire truck at the request of the state of Oregon through the Emergency Management Assistance Compact, in which all 50 states are members. They are scheduled to return on October 1st. The fire crew is part of a task force established with fire departments from Grand Forks, Minot, and Williston. Their primary mission is to protect structures impacted by the fires, and they have spent several days clearing brush and trees as well as setting up a fire sprinkler system in a historic building. On Sunday, they had their first encounter with a battling fire. They are working 15 to 18 hours a day. We will now watch two videos that the communication team has come up with.
Late last week, we were notified that through the North Dakota Department of Emergency Services that there's been a request by the state of Oregon to provide structural fire protection in their state. This is done through a program called EMAC, the Emergency Management Assistance Compact. That request is a governor-to-governor request. So this had to go through Governor Burgum late last week. After reviewing the request, Governor Burgum signed the authorization that allowed North Dakota Resources to travel to Oregon. Being deployed for 18 days is what the request was. You just don't get to drop and do that at a moment's notice. We had to talk with our personnel. We put a notification out that the request was there for personnel to be deployed for 18 days. We asked who would be available to go. We had about 25 personnel indicate that they would be willing and able to go for that period of time. You know, the request was for structural firefighting, so we sent them with their complement of protection equipment that they have here that we assign with them each and every day for their use here. Also, they have available to them all the equipment that we have on a fire engine, because the job will be to respond to emergencies and do structural fire protection similar to what they do here. The firefighters came from all areas of the city. Rest assured that all crews and all trucks will be staffed as normally here in Fargo. The citizens of Fargo will never see a change in the level of service that they're used to from our community because of this event. Late last week, we were notified that through the North Dakota Department of Emergency.
Oops.
Part of it's pretty routine as far as the schedules are the same. But at the same time, it's really dynamic because when we wake up in the morning, we don't really know what we're going to be doing for the day. And even after we get assigned something, that can change from hour to hour. So normally the camp gets going around 5:15 in the morning. And then we have breakfast, get the truck ready to go for the morning. And we go meet at a staging point down in Cave Junction. And then we come back, we do our work. We work between 14 and 16-hour days. And come back to camp sometime between 8 and 9 at night, grab some dinner, try to get a quick shower if we can, and go to bed. So really it revolves around working, eating, and sleeping is about how most of our days go. We did some structure protection work there in the form of making sure that the line along the road that they were using to stop the fire was solid, and that there wasn't going to be any fire that came across that line, and like logs rolling across the road that were burning down into dry brush that would start burning again, or making sure that nothing overnight would get across there. So every day is different. We don't know literally from hour to hour what we're going to be doing. You know, there's people out waving. Everybody that drives by honks, especially the closer you get to the fire line, the more threatened the homes are. People are happy to see us here. We did have in Woodburn, Oregon, when we were driving out here, we were a few hours away from the fire still. We'd gone out in the morning to pre-trip inspection on the engine, and there was a girl that came by, and her mom was with her, and some firefighters had saved their house, and it wasn't us because we weren't there yet, but she wanted to thank a firefighter. And so she had drawn a picture, colored in a picture, and she stopped by the engine and dropped it off the morning that we were getting ready to leave Woodburn to come down here. So there's been a lot of good interactions like that, positive interactions, and people seem very appreciative of the work that all of us are doing. And just on this fire alone, there's over 1,200 firefighters. We were actually talking about it, and I think firefighters kind of thrive on that. I think that's why a lot of us get into the work, because even at home, when we're on our normal shift duty, it's not a whole lot different, because when the tones drop for a call, we drop whatever it is we're doing and we go on that call. And so it's not a whole lot different in that sense, that the unpredictability, but everybody's in good spirits. We're resting well at night. If they're feeding us, great. So they always say if you keep a firefighter fed, they'll keep working happily, and there's some truth to that. So it's great. So when we can get online, I know when we were driving here, we had better internet, and we were checking the fire department Facebook page, so we know there's a lot of support out there, and we really appreciate that. You know, we're enjoying it. We're staying safe. We have a great task force leader who has been doing this a long time. There's plenty of people in this task force that have some experience, so we know that we're pretty safe working with the people around us that we are, and we do really appreciate the support. It feels good to know that people are paying attention and trying to follow our story.
Chief, the rest of the department has to pick up when these guys are gone. I think we should give a round of applause to our fire department and how well they're doing in volunteering. On the agenda, we do have the masks coming up, the question about masks, and it's not for public discussion, but the commissioners asked me to open that up. So we will have a 30-minute discussion at the time that comes up. I know if you signed up with Kimber, if you'd be so kind to say if you're one of the mask people who want to speak, that you tell her that. And then I would ask people maybe who have previously spoken on this topic if you'd give way to other people who haven't heard from yet. I'd like to do that because there's only 30 minutes, if you don't mind. Is there a motion to approve the order agenda with the listening session and tabling item 40 from the regular agenda for 2 weeks?
That's a move.
Is there a second? All those in favor say aye.
Aye.
Opposed? Motion carries. Is there a motion to approve the minutes of the September 8, 2020 regular meeting?
So move. Second.
Any discussion or changes? All those in favor say aye.
Aye.
Motion carried. And is there a motion to approve the consent agenda, item 1 through 33?
Move to approve.
Second.
Any discussion? If not, roll call.
Preston,
Aye.
Gehrig,
Yes.
Pepcorn,
Aye.
Strand,
Yes.
Mahoney.
Aye. Item 34, presentation of the community development projects. Tia Bresseth to tell us, and I guess Nicole Crutchfield as well.
Yeah, I was just going to introduce Tia, our Community Development Division Head, and she presented this to the Community Development Committee a few weeks ago, and we thought this would be good for the rest of the City Commission to hear. We don't have very many moments to celebrate the work we do, but I would say Tia and her team have done a fabulous job over the last 18 months getting these projects secured and implemented, and so I'll just pass it off to Tia.
Thank you, Nicole. Good evening, Mayor and Commissioners, and thanks for the introduction, Nicole, and thanks for having me this evening. I'd like to just give you a brief presentation on some of the work that the Community Development Division has been doing over the last 12 months. As many of you know, our primary role is to work on affordable housing and homeless-related strategies, so most of the projects that I'll show you are funded under our HUD programs, which are generally for those types of activities. So first, I'll just cover some of our affordable multifamily rental housing. This is Homefield 3 by Beyond Shelter. This is an affordable senior rental housing. It's expected to start construction this fall. These complexes are located south of the zoo near the new Bethany Retirement Living Facility. So the image that you're looking at is Homefield 1 and 2, and the third one will just be off to the right in that picture. Here's another Beyond Shelter project, which is expected to start construction next year. It will be located just west of the sanctuary downtown. This is also a senior rental housing, and it was named after a nearby historic district, the MEBB Historic District, which is highlighted in orange. Here's some perspectives of what that building is proposed to look like. Here's another senior rental affordable housing project that is being developed by the Fargo Housing Authority. Construction is expected to begin this fall. This project will help in rehousing some of the people that are moving out of the high-rise. It was named after Jill Elliott, who has been with the Fargo Housing Authority for decades. We have also been working on single-family homeowner housing infill projects. Some of you are familiar with them, and they include projects in partnership with our inspections department, Habitat for Humanity, the Cass Clay Community Land Trust, and Rebuilding Together. Here is a house that was torn down for blight and will be redeveloped by our land trust. We received it through tax forfeiture. So this is just east of the Gladys Ray Shelter on First Avenue. This is a similar story. This house was also received through tax forfeiture. It is blighted and will be demolished in the coming months and then donated to the land trust for redevelopment. So as you can see, some of the photos from the inside show and demonstrate that it is blighted, which is why we want to take it down as soon as possible and build something new there that will be affordable for a new family. This is also a similar story. This lot will be donated to Habitat for Humanity. It previously had a fire-damaged house, which we tore down for safety reasons after purchasing it from the homeowner. So this is just east of the hospital up north. And some of the photos from inside of that property. So it was beyond rehab. And this is also another Habitat lot for donation. We purchased this just for this reason. Sometimes we can do that with vacant lots if we have a partner in mind. So this is right next to Carl Bend to the northeast, and both this project and the last project up at 702 2nd Avenue North will be built out in the next 1 to 2 years by Habitat. And here's some examples of what infill homes can look like. These are all examples from Habitat for Humanity, but from any other partner, they would be relatively similar. Here's another infill project along 13th Avenue South. If any of you have gone by it lately, you'll see a lot of work taking place there. They've done quite a bit of digging. Rebuilding Together will be building a twin home on this site and working in partnership with the Land Trust afterward. So some of the other projects we do involve public facility improvements and acquisitions. This is Washington Elementary School. They built a new and more accessible park last fall. We're also currently working on a rehab project at the Gladys Ray Shelter. Here are a few of the progress photos. We also assisted Youth Works with the purchase of a building to have more beds for youth who are homeless. This is just west of Sanford Clinic on South University Drive. And then we also have our long-lasting single-family rehab program for homeowners who have low income. This is just an example of one of the properties that was improved under that program. And additionally, we work on public service type projects, which are a little less tangible when it comes to photos, but are equally important. And then finally, here are some future projects that we have on the board. I'd also like to let everybody know that we are currently seeking proposals for projects to be funded under these HUD programs, which have funded these projects that I have showed you. That will close October 9th, so if you're interested in applying for that, please go to our city's website for more information or reach out to me. Just contact the planning department at the City of Fargo. And that pretty much wraps everything up that I wanted to share with you. Thank you.
Tia, is it true that you perhaps have some more federal money coming in next year, or some more money to help you out in some of your projects?
We do. We just found out last Friday that we have another coronavirus CDBG fund coming to us, which was more than our original phase 2, I believe, or phase 1 that we got. So it's a little over $500,000.
Any questions by the commissioners? Thank you. Great report.
Thank you.
COVID-19 update. Desi Fleming to preside on this.
Good evening, Mayor and Commissioners. So currently in Cass County, there are 528 active cases, with the cases increasing over the past weeks. As you can see from this graph from our dashboard, it shows the 14-day rolling average for new cases. So cases in our area are increasing again, and obviously across the state, they are significantly increasing. We had a current case high of 93 back in May. We are getting close to that point again. Of course, in May, we had the benefit of it going into the summertime and people being able to be outdoors. And now our cases are increasing, and we're going to be going into the colder seasons with that indoor air confinement, which may add to our challenges for containment. Deaths and hospitalizations in Cass have remained fairly low for several months. We're currently at 77 deaths. However, our highest age group now for infection rate is 15 to 29-year-olds. So we are now starting to see some spillover again into our long-term care with staff and residents due to that age group kind of being out and about working in some of those facilities. We know that the mortality rate for that long-term care population is especially high with this virus, so that is concerning to us. There's also more research out about healthy young people, healthy adults that have mild to no symptoms if they're COVID positive, but they are having longer-term health effects that are lasting maybe months after their diagnosis. So they're terming these people the long haulers because they are suffering after a seemingly minor illness, and they're having problems. So the thought that this virus is no big deal for young, healthy people is maybe not so much the case anymore. This is a slide that shows the metric that the state uses to kind of grade our risk category. So we're currently in the green designation based on what the state has put out, although they have said they're only going to change that every 14 days. Probably they evaluate it every week. So these are based on 14-day rolling averages. We are in the yellow designation for the average active cases per 10,000 residents at 23.7 for Cass. We are also in the yellow category for the average positivity rate, which is at 5.8% for Cass. Both of these have been continuing to increase. We are in the blue category for our testing, which is at 56.2, and that, of course, is due to the pretty robust testing efforts that we have in Cass County based on our targeted testing matrix. So all of these have been increasing steadily since August, kind of around that time when school was coming back into session. The state also considers other factors when determining risk levels that may include population density, deaths, hospitalization rates, and current active cases within our county. So from a local public health perspective, being that 2 of our indicators are in that yellow risk category, we have been, if people call us with large events, we have been advising to go by the yellow risk mitigation factors. So even though we are in the green designation, we've been asking them to be more cautious and to follow the yellow guidelines. So we have been taking that upon ourselves locally to do that. Contact tracing efforts continue. We have 23 staff covering 9 a.m. to 9:30 p.m. Cases are becoming much more complex. We are probably having double to triple the amount of close contacts per positive case. We are seeing more non-compliance with people providing information, those not willing to follow guidance. It's really a challenging effort. For the most part, people in the area are doing what we ask of them. But again, for any of you, if someone calls, if you're a positive case, if you're a close contact, please provide the information that's asked of you when people call. That helps us to identify potential new cases and to eventually slow our spread. As a state, we are making national news a lot lately, and not necessarily in a positive manner. We need to do better with our compliance with masks, with social distancing, hygiene, listening to science in order to get through these next 6 to 8 months. We need to support our community and businesses that are making efforts to mitigate risks and continue to talk and live our public health prevention messages. At some point, we have to be willing to make unpopular decisions, knowing that the outcome will be worth the effort. I recognize there are varying opinions. I also understand that everyone wants us to be normal again. The reality is we're a long way from being normal in this pandemic.
Any questions of Desi?
Mr. Chairman, if I could ask.
Preston.
Desi, you mentioned that there's approximately double the number of contacts per case than when it began. Any speculation as to what's causing that? People are just tired of it and they're acting...
It's actually, so the amount of people that, well, it could be a number of things. So people, if they're not masking and they're out having contacts. Also, when we had our higher numbers back in March, April, people were more indoors. So the amount of exposure that they had is probably less than now when people are out and about, and if they're not following those precautions, then we're getting way more contacts than we used to have. Plus, it's in a younger age category, so they tend to be more social.
Can you tell me one more question, if you don't mind? With the mask campaign that's coming up, is there going to be any discussion about encouraging people to tell who they've been having contacts with if we're having trouble with that?
Well, I don't know if that's actually in part. I mean, the campaign really is about, doing it for everybody else. Like, we need to kind of band together to do this, so that we all get the benefit of the masks. I think the part of the contacts piece, there's a number of reasons. I think people are tired, and I totally get it because I'm tired. But people, they worry about getting someone else in trouble. They worry about different, there's many reasons that people don't share, but just to understand that it's really important that we are able to get that information to be able to investigate properly and to give people, that instruction that they need to keep others safe, because there again, we never know who is going to be negatively impacted, and we want to prevent that from spreading.
Maybe we should think about doing some kind of communications to encourage people, to get them to understand why we're asking those questions, and to encourage them to let us know who.
Yeah, and part of we do have a website that would be associated with our mask campaign too, and that kind of tells the why, like why we're asking you to do this, what it protects.
Perhaps some Facebook postings or something too would be good.
Mr. Peppercorn.
Yep, Mr. Chair. So a couple of numbers that I'd like to see is, like when Commissioner Strand asked, were there any deaths from construction this year? What I'd like to have us know is how many intensive care beds are in Fargo, and what's the capacity being used right now from COVID patients? I think that would be a good ongoing number. That's the first thing. And I just think we need to be very careful, because this is, by us making rules, it's a big step. And so I just think the more information we get, the other number that I'd like to know is how many deaths are strictly from COVID, with no other possibilities involved. I guess that's the other number that I'd like to know, if you can, in the future, obviously not tonight, but in the future, I'd appreciate knowing those. Thank you.
Sure.
Commissioner Strand.
Thank you, Mayor. Desi, you know, it's been a while since we've said to you, I hope you're all taking care of yourselves and keeping your batteries charged. This is a long road to hoe. And I can't imagine the stresses on you and your department and your people. But my question is a little bit further out from your folks. I heard recently that there were about 200,000 deaths nationally, and I've heard over 900 of them are frontline healthcare workers. Do we have any sense of locally how many of our people who are the heroes on the front lines taking care of the folks affected by this pandemic, the risks that they've faced or health illnesses and deaths are locally? Because that's 1 out of 200 is a healthcare worker who's trying to help people. So I'm curious how we can localize that.
I don't have statistics. Anecdotally, have I heard? Yes. I mean, I think there's the exhaustion factor. There's, yeah, I mean, you put yourself in risk. You're in the front lines. And so there's that fatigue. I know that from a turnover standpoint in healthcare, that has impacted it because people, it's hard work and it's stress. And so people sometimes are leaving the field because of that.
Take care of yourselves, please.
Mm-hmm.
Commissioner Pepcorn's question, sometimes it's a multi-organ disease problem when you get COVID-19. So it may be hard to just isolate COVID-19. They may have it with a multi-organ because oftentimes their kidneys fail, their lungs fail, their heart fails. So it is a little difficult to ascertain that. I think you'd almost have to say COVID-19 associated probably caused the death. I think that's what you're asking, Dave, is did it cause the death? And that may be difficult to get just because when I'm asked to list the death summary, you list every disease they have. So it doesn't always say this is just from COVID, this was from heart failure or kidney disease. So we'll look into that to see if we can do that. Thank you, Desi. Mm-hmm. Item 35, which I see a lot of people want to talk about tonight. John Strand bringing mask policy recommendations, and just so the public knows, we do have a mask directive as there is now that was passed by commission last session. There are no enforcement there. There's no fines with that. There's nothing else. It's very strong advice that you wear a mask when you can't social distance. You wear a mask in buildings and public places. You do social distancing, and you also will do hand washing at the time it happens. Commissioner Strand wanted to revisit the policy, which he warned us about 2 weeks ago, and bring up some discussion items.
Thank you, Mayor. If you don't mind, I wouldn't mind hearing from the citizens first. Then when we deliberate, we can go into the work of the motion.
Well, it'd be helpful for the citizens to know what motion you're suggesting, John.
Absolutely. I found myself researching what others have done to get some examples and benchmarks about what might work and what might not work and what would fit with the concerns raised by folks locally. As you know, there's just a million opinions on something like this topic of whether you have a mask mandate or not. And then there's the overarching goal of what's for the greater public good and for the greatest number of people. And how can we, if we embark on those discussions, how can we minimize the impacts on other people so that they're not as harmed or in their own ways limited in their participation in a process that would lead to a healthier community. You know, we're hearing the news today that our schools are now affected. You know, we can think in our minds all we want that what our personal actions are have no impact, but they do. And every single one of us plays a role in a healthier community going forward. And there are pros and cons of what we do that would lead to that healthier community and the practices. But I'll say this, you know, there are hundreds and hundreds of examples of us following rules and laws for the greater public good and for the safety of the public. If any of you drove here today, you had speed limits, you had stop signs, you had lanes to keep your cars in. If any of you go out into restaurants or bars, you have limits. How much can you drink? How much can you consume if you're drinking or driving or going out in public? Can you light up a cigar or a cigarette in your restaurant? You know, we've had these arguments many times before. in our community and other communities of people deciding to take actions that are for the greater good. Now, if I didn't sincerely believe that there's a value to elevating the community's response individually and collectively to this pandemic, I wouldn't be bringing it forward to discuss. But we as a city commission need to keep this front and center. We need to be talking about what are we able to do, what can we do, what ought we do. And then at the right time, when the dust settles, we can pull back on these actions and hopefully acknowledge the successes of our collective efforts to have a safer community. So we're all hearing from a lot of people. What I've done is, in my research, is I looked at what others have done, and I found out that there are examples of people who've done implementation of policies without civil or criminal penalties attached. New York State was the very first example I found in early April when they were a hotspot. None of us wanted to be them. But we could maybe replicate their successes in some of their efforts that led to a flattening of the curve. And that was one of the efforts they did, was to have a mask policy that said, wear your masks. We're not going to send our police after you. We're not going to cite you. We're not going to fine you. We're not going to fill our prisons up with mask bandits. But on the other hand, we have to have a benchmark that establishes a clear policy for the greater public good. So we've, in our research, in our MICE research, I've looked at the New York example and the Arkansas examples. What we'll be presenting tonight, what I'll be presenting tonight, it may not even get a second, is a path forward to have our legal counsel bring back to us immediately a policy that reflects to a degree what we see in the New York policies and in the Arkansas policies that give the room for people to have the flexibility in their own personal circumstances, where if they can't wear a mask or are not able to wear a mask, or they have reasons for not being able to participate with a mask, those allowances are in these policy considerations. Children, people with health conditions, people who say they can't breathe and stuff with it, those accommodations can be absolutely made if we care to act accordingly for the greater good. So I'm absolutely open to hearing from everybody's viewpoints. You all know where I'm at. I'm trying to find a compromise that we can live with that says, let's listen to everybody here. Let's bring everybody's viewpoints into us, but let's do some action on the local level that will show a result that will save some lives or help some people or get us through this pandemic sooner than not. We have an immense risk. So I ask all of you to just, as much as you're able to, I know you have your views. Some people say to me, this isn't you're infringing on my constitutional right to wear in this country if you make me wear a mask. I go, for God's sakes, constitutional right?
And no dialogue.
And we'll hear your views on that.
Quiet.
So we'll hear
John, don't engage conversations. They get to talk when their time is to talk.
Let's all continue forward. I look forward to
Commissioner Strand, I do want to just go through the New York ordinance that you're referencing and want to make sure that you understand they have penalties. And in that it says the violation of any provision of this subpart is subject to all civil and criminal penalties as provided by law. Individuals who violate this subpart are subject to a maximum fine of $1,000 for each violation. Are you aware there was a penalty in this?
New York gave the folks, the local levels, the ability to decide at their local jurisdictions what to do or not. And the original implementation didn't have any enforcement. But they allowed the local governments to decide that.
But you're intending penalties or not? I just want to understand.
What I'm suggesting is no penalties, no citations, no civil criminal enforcement to this. And then let's hear from all of you.
Mr. Chair.
Let's hear from folks.
Mr. Chair, can I just say something real quick? So here's the rules. This is a city commission meeting. If you behave yourselves, then you can stay. If you don't behave yourselves, you're going to be asked to leave. If you don't leave, the police in the back of the room are going to remove you. Is that clear? All right, thank you.
We'll start with open discussion. I remind you, you have a 2-minute, 30-second time limit on that. And some of you have already sent emails to us, so I'd ask you just keep your remarks brief because I have quite a few people who want to speak. And we're going to do this for 30 minutes. If we don't get through all the people, that's when it stops. So 35, Glenn Knutson is first, Loretta Smith is second. If you just start to get close to the mic so we can get going on this.
Mr. Chairman, if we could get the motion read so they know what we're considering tonight.
Absolutely. The motion will be as follows. I move to direct the city attorney to draft an ordinance establishing a mask mandate as presented, to place the matter for receipt and filing at the next regular city commission meeting, and to recommend that at the next meeting, the city commission consider waiving the requirements of an ordinance being received and filed at least 1 week before first reading. Does that make sense?
Okay, Glenn?
Thank you for allowing me to speak. I'm speaking on behalf of a number of people who couldn't make it tonight or were unable to be here, and some who are here that do not want to speak. First of all, I was going to go through the difference in masks. I encourage you to go to 3M's website. The cream de creme of the mask is the N95. They say on their own website, it will not stop bacteria and viruses. The surgical mask is a Nest mask, and that is designed not to stop viruses and bacteria. It will slow them down, and less will be exposed to it, but it will not stop it. The third mask is the cloth mask, which usually will have holes, and it's kind of like putting up chicken wire to keep out mosquitoes. And it will not stop viruses. You talked about the collective. I'm talking about the individuals. Every person that's a citizen of Fargo is an individual, and they have certain needs. And when you impute for the collective at the expense of the individual, it is not good government, nor is it prudent keeping track of your responsibilities to take care of all the citizens of the city of Fargo. There are many people that cannot wear masks. There are many people that right now want to go to Costco. And if they go in to Costco and say, I can't wear a mask, sometimes they're let in, sometimes they're not. And they may have medical reasons. They may have religious reasons. They may have political reasons. But they are given evil eyes and ridiculed for not wearing masks. And yet the masks, by literature on their own websites, says that it will not stop viruses. This is more about control, and it is more about stopping people from, there's a lot of things that masks wearing does. It doesn't enable you to get the emotional response from people. And I go around the city, I go to the bank. In my bank, they don't wear masks. And everyone that I talk to is so thankful they don't have to wear masks. And guess what? I can see their face. I can see their smile. I can see their response. If they're wearing a mask, I don't know how they're responding. And this is destroying the individual for the sake of the collective. Know what that sounds like? China. It sounds like Russia. It sounds like other countries. Thank you for giving me the opportunity to speak.
Loretta?
Thank you for the opportunity to speak to you tonight. I emailed all of you this afternoon. I'm going to be as quick as I can. According to the North Dakota COVID dashboard last night, the deaths due to COVID in North Dakota are 139. I want you to know I believe that every human life is significant. 7 years ago, my son was shot and killed. Several weeks ago, an 8-year-old in Grand Forks completed suicide due to the effects of COVID-19. I recognize that people are afraid to die. Death is appointed for us all. We're not going to avoid it, nor can we run around afraid from a microscopic virus we cannot see that might be the mode that will take us, especially when we know this virus has a 99% plus survival rate. What we should be doing is endeavoring to live the healthiest lives possible and enjoying such lives as our founding fathers fought for us to have. The CDC continually misrepresented national numbers to the American public and then recently very quietly and subtly updated statistics, as well as made known, as has been reported, that the total number of deaths due specifically to COVID-19 was or is actually only 6% of the total number espoused. Why is that? Again, a 99% plus survival rate. 15 days to flatten the curve came and passed. Wearing masks continually serves to damage individuals' health. I quote Dr. Jeffrey Bark, medical doctor, Newport Beach, California. Mask wearing should be properly fitted. Face is constantly being touched. Cloth masks develop moisture inside, making the mask more permeable to pathogens. Unless properly vented, carbon dioxide can build up unhealthily. I'm going to move on. It is known there is a mass campaign going on in our state of North Dakota pushing these mask mandates. A lot of money has been poured into North Dakota to fuel this campaign. Shortly after the governor created the task force to do something for COVID, the curve did go down significantly, yet nothing was done substantively. But the governor took credit for the downward curve, but then it went back up. Currently, the curve has exceeded the previous curve. This makes no sense at all, but what does make sense is the virus is being transmitted, and government intervention has obviously very little impact at all. I want to close with the Mandan Mayor, Tim Helbing, said he does not think there's enough evidence to prove that masks are effective in reducing the spread of COVID-19. He said, I believe in people's freedoms and their right to choose, and we agree with him. Thank you.
Thank you for speaking fast. Our next two speakers are Vicki Bailey and Jane Winston.
Thank you for having this tonight. I'm a business owner in Fargo. I'm a hairdresser. I work with people closely. I work with a lot of people with a lot of different health issues. And I just want to share a story. I went into Moorhead to have my oil changed because there was a business in town that said, you don't even have to get out of your car. You don't have to get out. You don't have to talk to anybody. You pull in. We're going to change your oil. So I'm like, great. No exposure. I'm all for that. That's fine. So I get in there and he says, hey, you got to put a mask on. I go, what? I'm in my car by myself. I don't even have my kids with me. He goes, no, you have to have a mask on or I'm not going to change your oil. I go, seriously? I'm going to roll my window up. You're going to be under my car. How am I going to expose you? Nope, won't change my oil. I said, fine, I'll take my $110 then and I'll go somewhere else. And guess what? That's happening all over Minnesota. People are coming to North Dakota to get their hair done. They're coming to North Dakota to get their oil changed. They're coming to North Dakota to buy their groceries. They're coming to North Dakota to do an awful lot of things. And Minnesota is losing an awful lot of money because they have a mask mandate. People like myself have high anxiety. I can't wear a mask. My chest feels like it's caving in. I can't breathe. I have a client who has a restricted airway. She can't breathe. She has a medical card in her purse. There are things that people can do, I agree. If you need to, you can wear a shield. If you feel compelled and your health is not set, then go ahead and wear a mask. I have no problem with that. If I have an elderly person in my chair who has compromised health, guess what? I have a mask there. I'm going to wear a mask and I'm going to give her a break. I am all for keeping people safe, but I'm also for personal responsibility. Wash your hands, stay home when you're sick, take care of your family, eat healthy, drink water, exercise, get outside, get some fresh air, and get the mask off. I'm sorry, but I disagree with the mask mandate. I think it's an infringement on my personal rights. I'm a human being, I'm an American citizen, and I have rights, and it's not a constitutional matter whether or not I wear a mask. It's not listed in the Constitution last time I checked. Thank you.
Jane, actually, the other mic is where we have people speak. I'm sorry. Typically, staff is at that. We try to not get them contaminated.
Thank you. I'm going to remove my mask to speak so that I'm easily understood, and I want to express my support for Commissioner Strand's mask mandate proposal. And I'm a physician, I am a family doctor, and I'm also a geriatric specialist. I care for the elderly people in our community. I've cared for them my whole career. And last month I spoke to you, Mayor Mahoney, a physician to physician, about it's a very hot issue. We've obviously heard a lot of very emotional pleas already this afternoon. So I know it's something we shouldn't take lightly, but I want to speak to the mask mandate. The numbers have been very confusing and interpreted differently based on news organizations. The state health department, I was encouraged to hear our county health department administrator talk about utilizing the yellow level, even though the state hasn't moved us from green. Our numbers are there. And the bottom line in the forum article about the numbers today was, any way you look at the numbers, they're going up. I don't think you can find a North Dakotan who wouldn't know that cases are going up and unfortunately deaths are going up. And it gave me great pause as a grandmother to read that the Fargo School District today announced that they're going to pull secondary and middle school children back to all remote learning. And one of the metrics they look at are deaths. Whoever thought we'd be looking at deaths in the community when we talk about educating our children, their risks of dying going to school, per se. So the numbers are confusing, but I think everyone can agree they're definitely going up. And I believe that increasing by implementing this vital public health measure, which masks work scientifically, and is vital to slowing the spread and flattening the curve in our county. And we can be leaders in the state by doing that, and I would make it time limited so that everybody has a goal. The schools are doing a 2-week period with their designations of remote versus live teaching, and then reassessing what the numbers are. And that's a goal for us to achieve, to keep our kids in school. And I think it also would protect the the economics of businesses in town, that we won't have to, our commissioners won't have to restrict the numbers in restaurants and the numbers who gather. Dr. Deborah Birx from the White House, the White House Task Force, when she came to North Dakota, she advised masks. And she said, it doesn't help to have data if you don't use it to act on it. Thank you very much.
Mike Felber and Wes Falone are next.
Good evening. Thank you for giving me a chance to speak to you tonight. Our family moved to North Dakota 2 years ago, so I'm a relatively new resident to this area, but I can tell you how much we enjoy it. I've appreciated the leadership over the last 2 years and have publicly mentioned how I appreciate that you give us the information we need, but then you trust the citizens to make good decisions. I'm concerned that the mandate will remove the common sense response to some of the healthcare needs. I'm a pastor in South Fargo, and the impact of masks on the aspect of worship services and the community and the encouragement in our church, I believe, will be devastating. We minister to those who are hurting through financial, social, and mental discouragement. And I currently minister to residents in care centers and assisted living centers, giving hope to those who are hurting. Caring for our health compromised, I believe, is a personal duty as citizens, and we ought to be caring for those who we know have been compromised. But I believe the mandate will have a negative effect on some because it removes the freedom to make those decisions as for what would be best. My family also ministers in Indiana and Pennsylvania. Pennsylvania has taken a totally different approach than North Dakota has taken, and they have mandated masks. I've observed over the last 6 months how this mandate has impacted the church worship services and the people in those communities who are hurting. I realize that you're saying your intent is not to place civil penalties, but then you have placed those of us who take our response to civil law seriously and personally, and you've put us in a very awkward position. I don't submit because you give me penalties. I submit because I respect your position. And therefore, I respectfully ask that you would consider how this would impact our churches, how it would impact our ability to minister to them. I also have family in New York City, and the laws there have greatly impacted the churches there. I believe the damage to public worship will be greater than has been considered. Thank you for the opportunity to speak.
Thank you. Wes?
It's been 4 months now, Mayor Mahoney. It's Wes Philomade. Just a heads up.
Thank you.
He, him pronouns. COVID-19 is real. I have to be honest that I am a bit hesitant with a mandate. But if it ends up saving a single life, I am all for it. At the least, we should make them mandatory in our most critical public places like grocery stores, post offices, and yes, government buildings. It is time to place science above privilege. It is time to place the lives of our people over profit. Several people have been allowed to speak directly into this mic without a mask, which means that others now have to risk their lives to have their voices heard. You've tried the encouragement route. Unfortunately, your voices will never be louder than our president, who consistently gathers people without masks and social distancing. Encouragement will never work when Commissioner Garrick vehemently opposes masks. Just look around this room. It is time for our leaders to take lead and take action. Sometimes the people you lead may not always agree with the decisions you make, but if you have the best interest of the people at heart, in the end, the outcome will reflect this. Wearing masks is a preventative measure, not a cure. That window is closing. Lastly, it's not lost on me that special accommodations were made to this meeting to have people heard. But when we asked for our voices to be heard in the meeting regarding the police chief selection, we were silenced. Thank you.
Claire Derby and Arden Light are next.
Good evening. My name is Claire Derby. I use she, her pronouns. Before I speak on masks, I just do want to give acknowledgement that I've had several very positive, collaborative, and communicative interactions with the Fargo Police Department this week regarding an event taking place on Friday. And I just really appreciate that type of collaborative relationship, and I hope that can continue going forward in terms of other actions. In regards to masks, I want to reiterate what the person who briefed us on the state of COVID in Fargo-Moorhead is that sometimes as leaders we need to make unpopular opinions. Commissioner Strand, I really commend you for bringing this forward, knowing the type of backlash that it will receive. And while I might not agree with everyone on this commission, I respect all of you and believe you to be intelligent people. I believe you understand the data, you understand the science. Dr. Mahoney, you are a medical profession. I know you understand this better than most people in this room. And so I call upon you to do something that may be unpopular and know and act on your best knowledge and your best interest for the communities, because we believe that you have those at heart. Thank you.
My name is Arden Light. My pronouns are he, they. The COVID-19 pandemic is not going away anytime soon. In North Dakota, it's getting worse. We're the #1 hotspot in the country, and we don't have a mask mandate. Masks are the only thing other than shutdowns that have been proven to slow down the spread of COVID-19. People not wearing masks is not only reckless, it's incredibly disrespectful to all the professionals who are working with positive people every single day, like my aunt who works on the COVID unit just a few blocks away from here. We cannot talk about COVID-19 without talking about the racial disparities. COVID-19 is disproportionately affecting our BIPOC people. People of color are 50% of all COVID cases and 19 times more likely to require hospitalization than white people. Black Americans are 2 times more likely to die from COVID. According to the Mayo Clinic, the reasons for this stem from systemic racism. People of color are 1.5 times more likely to work as essential workers, such as grocery store clerks or hospital workers. Access to healthcare is also increasing the effects on our people of color. Black people are 1.7 times less likely to have access to healthcare, and Hispanics are 2 times less likely to have access to healthcare. As Wes said, a lot of people in this room who are against masks are white people, and that's a privilege that you have, that maybe you don't work as essential workers, you don't have to put your life at risk every day. A mask mandate is not something that Fargo will have invented. Lots of places around the country and world have mask mandates, so it's not like we're asking you to put in hours and hours of work to develop a new plan. All you have to do is take the research that Commissioner Strand has given you, take those mandates, make maybe a few changes so it works better in our community, and then sign it. And it will save people's lives. Thank you.
Thank you. No clapping, guys. J.J. Daniels and Bridget Ertel.
Hi there, thank you for allowing me to speak today. A lot of people here have talked about choice, and I think the one choice that we're overlooking here today is the choice of those workers that are required to keep their jobs during this pandemic. I'm a server in Minnesota. So while there is a mask mandate there, I cannot afford to live without going to work. And due to the fact that we're not receiving any support from the government anymore and things like that, my choice to be around people who do or do not wear masks is severely limited. I do not feel safe in environments where people do not wear masks. Even being here is a huge risk. And I find it incredibly frustrating that we're more concerned about the consumers and the customers than we are about the actual workers who need this sort of defense to keep themselves alive at home. And I guess the big reason that I'm bringing this up even is because there are so many people that are disenfranchised right now in this country. And there are so many people that look at those disenfranchised people and think that they are pushing onto them and taking away their rights, when in fact the rights of the employee supersede by far the rights of the consumer. So therefore, I am fully in support of the mask mandate. I think that the points that John Strand had made are very intelligent. And I do believe that supporting science over the community, over the individual in this case, where the community is at risk, is important. Thank you for your time.
Bridget? Janet Wendell's up next after that.
Good evening, and thank you, commissioners. I didn't have a prepared statement tonight because I wanted to see what the recommendations would be. I did email all of you, and I didn't receive a response back from anyone. Now, I understand you guys have probably been flooded with emails and calls, so I'm not gonna, chide you too much on that, but I do want to keep a dialogue open, and so would appreciate responses in the future. Commissioner Strand, excuse me, no disrespect. I guess I would ask to you, why did you look to New York for an example for mandates? Their response was dismal at best. And if you really want to look for an example, I don't know why you wouldn't have looked to our neighbors to the south, in South Dakota. If you want a leader in this appropriate role of government, I would have started there. And I have a couple other points here. I'll try to get through them real quick. Just to the points where you had mentioned, Commissioner Strand, the role in a healthier community, that starts with me. That starts with my choice, my individual responsibility to my health. And are there limits to my health freedom in what I choose to decide what is best for me? I don't think there should be. We've discussed the recommendations, the directive, it passed. The commission passed a directive, right? That's our response to the COVID-19. You guys approved it. Now it's not good enough. I don't think we should be flip-flopping because the CDC really doesn't need any competition. I don't want to be argumentative. I know this is coming across as such, but I apologize. A little charged up over the issue. I've been to these meetings, I come to learn, and I want to be respectful in hearing what you guys have to recommend. I don't always agree, but I do stand firm in opposing further mask compliance and force. That's the biggest thing, force. That's never a good equation with government. Now you want an ordinance. I don't agree with that. I find that unacceptable to move from a directive to an ordinance. That's a big leap. When does it end? What is an expiration and the sunset clause on the ordinance? In closing, please make this policy voluntary, not mandatory. My health is my responsibility. I stand for health freedom. I hope you do too. Thank you.
Andrew Peterson is next after Janet.
Now I don't know which one is on. Both are. Okay, I too didn't make any specific comments ready because I wanted to see some of what was said tonight. It was mentioned that an 8-year-old in Grand Forks completed a suicide this past month. And it wasn't really stated what exactly had happened. She was so terrified by the fear rhetoric that she kept hearing around her that she was convinced that she was going to be the cause of her family dying and her grandparents dying. And she couldn't handle anymore the terror in her heart that it would be her fault. That's what this stuff is doing to our children. You put masks on the faces of almost everyone around them. They can't read your emotions. They don't know what to think of what your intentions are. You're doing a lot of damage to people when you put those masks on because you don't look human anymore. And as for masks, think about all the junk that you find in your lint trap, in your dryer. That's the stuff you're inhaling when you have a mask on your face. They don't keep viruses out. They get through like putting up a chain link fence to keep the skeeters out of your yard. But you are taking in fibers. You are taking in contaminants. You are taking in the chemicals they were packed in. Have you ever opened up a package and smelled how musty and horrible they smell? You're putting that right on your face. And it's already been mentioned how they get moisture inside, the things that our bodies are exhaling to get rid of the toxins in our lungs. You're keeping that on your face. Now we're getting a lot of people with infections in their lungs, in their skin, and various other things because of the mask. They are not healthy, they're filthy. And now I'm seeing them on the ground blowing around all over the streets. That's disgusting. Enough of this. Thank you.
Brad Friesen is after Andrew.
In the beginning, all this COVID stuff was meant to flatten the curve, not overload the hospital systems. That's been accomplished. We've never had full hospitals, certainly not around here. And we're 7 months into this thing, and now we want to mandate masks. I'm very opposed to this. It's very elitist of anybody to think that we can control a virus. Minnesota has had a mask mandate since July 25th. Yesterday, they reported their highest case total yet. Why is all that? That's because of mass testing. This woman over here, she spoke earlier and said that the highest numbers are in 15 to 24-year-olds. Colleges were requiring testing to get on campus. Obviously, that's the reason. That's the age range of college students. My daughter, won't name where she works with many college students who walk around telling her that they get tested every day because, well, it's free. Why not? Why not get tested? Also, if you do put forth a mandate, there's no way to enforce it. How do we enforce it? If you can't enforce it, why bother putting it forward? My kids don't want to stop going to church. My kids don't want to stop, going to the library. I refuse to put masks on my children. It's not healthy. South Dakota has very similar demographics as North Dakota. They haven't done much of anything. And you know what? They've trusted their citizens and their leaders, and they've had similar numbers as we have here in North Dakota, Fargo, comparative to Sioux Falls. Mass data can be cherry-picked on either side of the aisle, for or against. There's stuff to back up both sides. As Bridget stated, there's no end date to any of this. Minnesota has a mask mandate in perpetuity for now. That isn't the way to rule anything. Life's only worth living if we take a few risks. We all take risks every day. I go to work every day. People say that it's mandatory workers. I'm a mandatory worker. I take a risk every day I go to work. I don't wear a mask. I'm not sick. If I was, I would stay home. That's the right thing to do. Let us regulate ourselves. Thank you.
Brad Friesen. And Mike Trottier is next.
This one? I didn't have prepared comments either because I was very curious about how many people would be here and how many people would be speaking. I appreciate a lot of the opinions, especially the ones against masks. You hear science talked about a lot. The CDC is supposed to be the head of that and have all that data. On their website, they make statements for the death certificates. If you can assume the person died from COVID-19, you can put it down. And it says it right on their website. That's not science, that's not data, that's a big lie. I mean, it's a big fudging of data, and we've seen that happen over and over again. As far as our protecting our children, and with a mandate that came out today just from the Fargo Public Schools about online teaching, the last study I saw on children's infections, there was a study of over 500,000 children, 500,000. 100 had died from COVID, they said. Who knows how they got that data? 0.02%. Now they're saying all those children stay home, take care of yourselves while your parents are at work. If you're special ed, good luck. If you're an English language learner, good luck. You've got a crowded, multi-generational home. And instead, you have to stay home where it's better for you, it's safer for you. It's not safer. There's domestic abuse, there's the depressions, there's the suicides, there's the whole mix of things that happen there. I really see that also we don't get a balance in reporting. There's nothing, virtually nothing that you hear about vitamin D. Vitamin D is really healthy and it really works to help diminish the problems of COVID-19. But instead it's masks, masks, masks. Wear it when you're running, wear it at the beach, or don't go to the beach, or it doesn't matter if you're homeless, because then it doesn't matter, you can sit all together. There's just a mix of either it's all or none. And if there is some kind of a mandate, it needs to be clear. What's good for you, what isn't? It's not good to run, you breathe in 21% oxygen, you breathe out 16%. Okay, you're gonna survive with a mask, but not in, there we go. Last comment, I just say if there is a mask mandate, we're gonna end up wearing these.
And you are our last speaker.
Good evening, Commissioners. Say just a few things. I'm glad you brought up New York to talk about, because let's talk about New York. 11,000 deaths, where were they? In the nursing homes. Why are they killing grandma and grandpa? The Star Tribune in Minneapolis reported 81% of the deaths in Minnesota are in the nursing homes. Why are they killing grandma and grandpa? The doctor over here can maybe answer some questions about the N95 mask. So it'll stop 95% of 3.0 size microns from coming through the mask, 95%. Ask her what the size of micron the COVID particle is. 1.17 to 0.004. The mask is stopping nothing. A couple of my friends asked me to ask a couple questions if I got up here tonight. The first one was, what constitutional authority do you have to mandate masks? Ask cite actual subsection and line. If you could answer that, that would be great. The second one is asking me the cycle threshold being used. Because as the cycle threshold goes up, the chances of you spreading it goes way, way down. And we never hear this stuff reported. Again, these are numbers and facts that we need as humans and as informed citizens to make the proper choices. My doctor probably said it best when I asked her about COVID and wearing a mask. Her exact words to me were, it's to show us a sign of respect to your fellow citizens in the neighborhood as you're out and about. I don't need a mask to show a sign of respect to others. There was a young gentleman up here earlier that's saying, I'm a white supremacist now. I'm a racist if I don't wear a mask. I have not missed a day of work. I've been an essential worker. I have not worn a mask. It doesn't make me a racist. That's for certain. The other gentleman talked about his job and how it's more important for him to have a job than it is for the consumer. Do we forget that without a consumer, we have no jobs? The cost to our country right now is great. The cost to benefit ratio right now is way skewed. I thank you for your time.
We'll close public hearing. John, we'll open this for discussion on the commission.
Mayor Mahoney, I'd like to present a motion so that we can formally, if there's even a second, have this discussion. And I've modified it just slightly, so bear with me as I try to read through this paragraph. I move to direct the city attorney to draft an ordinance establishing a mask mandate as presented, to place the matter on for receipt and filing at the next regular city commission meeting, and to recommend that at the next meeting, the city commission consider waiving the requirement of an ordinance being received and filed at least 1 week before the first reading, and to review the policy as implemented, if implemented, every 3 months.
Is there a second?
I'll second it.
Further discussion? Commissioner Strand.
Mayor, bear with me, folks. I think it's important that we start talking about, so you have a sense of some of the restrictions or limits or openings in this policy as it'll evolve, if it evolves. Of course, we're talking about situations where people can't socially distance, generally speaking, if you're around other cohorts than your own family or circles of influence anyway. So, but if you are unable to social distance, and these are some of the exemptions that, in my mind, are on the table for consideration, and many of them focus in on some of the topics you've raised. Persons under the age of 10, persons with a medical condition or disability that prevents wearing a mask or facial covering, persons performing job duties where 6 feet distance is not achievable, but a mask is inhibitory to the ability to safely and effectively perform the job duty. Persons participating in athletic activities where a 6 feet distance is not achievable, but a mask is inhibitory to the activity. Persons consuming food or drink. Persons driving alone or with passengers from the driver's household. Persons receiving services that require access to the face or security for security, surveillance, or other purposes may temporarily remove a face covering while receiving those services. Persons voting, assisting voters, serving as poll workers, or actively performing election administration duties. However, face coverings are strongly encouraged. Persons engaged in religious worship activities. However, face coverings are strongly encouraged. Persons giving a speech or performance for broadcast or to an audience. However, those persons shall safely distance from nearby individuals. For the sake of our legal counsel and the commission, those are the types of options in such a policy consideration that would give people leeway to not wear a facial covering.
Any other discussion?
Mr. Chairman, if I could just acknowledge so that it gets on the public record, there's been an online petition with over 1,000 signatures on it. And if I could just briefly, it's not very long, just read the content of the petition. It says, as the largest city in North Dakota, Fargo is at the epicenter of the COVID-19 epidemic in the United States. As of mid-September of 2020, our state has the highest per capita per person number of new infections in the U.S. The number of infections in Cass County has increased sixfold in the last month. With adequate precautions, COVID-19 is preventable, yet too many people in our city are getting sick and in some cases dying. There is ample evidence, as stated by the CDC and endorsed by the North Dakota State Health Officer, that masks are essential. Both Governor Doug Burgum and his challenger in the upcoming elections, Shelley Lenz, have publicly supported mask wearing as key to public health. This is not a political issue. It is a matter of life and death. Our elders are not expendable, nor are people with disabilities or underlying health conditions. We cannot be silent while watching the growth in COVID-19 cases. We call on the Fargo City Commission to issue a mask mandate that will apply to everyone who enters a business, workplace, or nonprofit organization in Fargo. Currently, in spite of the clear benefits, mask wearing in Fargo is minimal. A mandate would remove the social stigma associated with mask wearing and dramatically increase mask use. We each have a role to play in prevention, not only for our own health, but for the health of our neighbors and loved ones. As our leaders, please support this life-saving effort for the city we love. Thank you. And at this moment, it looks like about 1,066 signatures.
This is a tough decision because you're bringing up mandate versus directive. The directive we have in force right now does not have any penalties if you don't wear a mask. It's a strong recommendation from your commission that you wear a mask when you cannot do social distancing, that you wear your mask in places like grocery stores. But the word mandate seems to evoke emotional response from a variety of people. And if you say mandate, that suddenly makes people come out from both sides. I would say the commissioners have heard all sorts of emails in the last 3 or 5 days. And the reason we haven't gotten back to some of you, we just haven't had time to respond because they're coming in and in. It makes good sense to wear a mask. That's what we directed. That's what we sent out in the directive. Unless you have some type of enforcement with a mandate, which you fine somebody or you cause them to some type of criminal activity, it's hard to enforce. To have my police force walk up to somebody and say, please wear a mask. If you don't, it's a $100 fine or $200 fine. I find that puts us in conflict with our police, not very comfortable. And any of us in a social position, if you ask somebody to wear a mask, it's sometimes uncomfortable when you do that. And I'm concerned about that as well. I would not support this because I feel the directive is saying what we're trying to tell you, you need to wear masks. Now, Desi and I know that our numbers may go from green to orange because we're hitting the numbers that we may well have to do that. And if you think about that, that's going to inhibit social gatherings. The schools have already gone to distance learning, which is horrible for our kids. It's really hard to listen and do things in distant learning. But the secondary thing is our numbers are coming up to a number. Are they going to go down or up the next 2 weeks? That's critical. So sometimes what you want to do is when somebody asks you to have a timeline, let's see what's happening. Because for some of us, what happened is we suddenly started testing a lot of people and our numbers went up. We're doubling to tripling the size we're doing. But we do something different in this community is we do contact tracing. So in contact tracing, you're contacting anybody who's positive, anybody you've had any contact with. And that's what drives our numbers down is getting right to the people that get the disease and taking care of getting them either isolated or quarantined. So it's a difficult position, but I think there's an emotional response to the word mandate, and that will tear our community apart. That's what we're getting, is I got 80% of response said no mask, I got 20% that went for mask. So whether you think it's not volatile, it is a very volatile thing. So roll call vote, please.
Mr. Chairman, if I could make one comment in response. I do think that we've taken a great graduated kind of approach to this, and a mandate, yes, it does provide or cause, I should say, an emotional response by all means, but it also communicates to the community that this is serious and it's getting more serious. So, I mean, we can jump right from a directive right up to enforcement, but I think there's a middle step, and that is making sure people know and understand that we know this is serious. And I think it will reach a few people that probably currently aren't making or aren't using masks and possibly could with the fact that we're telling them this is serious enough for a mandate. But that would be my take on it.
Mr. Strand.
So Mayor Mahoney, are you saying you would support this if there were a mandate?
If there
were enforcement?
Enforcement, if you're going to go a step up, no, I'm not saying necessarily I'll do that, John, but I don't think what you have is any different than what we have because there's no enforcement.
So, but would you support it if there were enforcement?
Not this time.
So if I might continue, you know, the earliest we'll get anything in place is October 19th. Are we going to have another doubling in the meantime of our numbers? Well, if not...
John, again, don't do dialogue with the audience. Just talk to the commissioners.
But October 19th is the soonest we can enact anything on this timeline. Every single day, there are lives in the balance. And if we don't act, we're not leading.
Mr. Chairman, if I could just add to that.
Mr. Preston.
Perhaps it's a matter of directing the language to be drawn up so that we have it prepared and ready.
Exactly.
And that's all that's being asked for tonight. Otherwise, it's going to stretch out even further if the numbers continue to go up.
Commissioner Strand.
When this discussion surfaced at the very beginning, you know, that was exactly on the table, that we need to be prepared in case the numbers and the trends don't go our direction. They're not going the right way. If I recall, we had 20-some people in the hospital then. I think today we have 88. I'm not sure in the hospital.
87.
87. You know, and so as Commissioner Preston indicates, if we have this in the wings ready to implement should it be needed, it's there to implement it sooner than not. We can vote it down in October 9th if the trends turn our direction and we don't have a problem anymore. You know, we don't have to act finally today, but to not have this in the wings as a preventative measure for the greater good of the community.
Eric, is there a reason we couldn't do something October 3rd if we had to? If health in the community was such a risk that we would have to do something immediately, what vehicle would we use for that?
Well, they're the steps, but you can shorten them. We don't normally do that, but you certainly can have special meetings. So you can, you know, there is the idea of receipt and filing. That's a requirement. Just as an idea, what Commissioner Strand suggested, we certainly could draft something and submit it to you. You could receive and file it and take no further action at the next meeting. But in terms of fast tracking it, you would just have, you could have special meetings. You don't have to wait 2 weeks necessarily. There's a requirement of at least 1 week between first and second reading, but that can be waived by the appropriate
And Commissioner
number.
Strand, would you have him draft a mandate with and without penalties so we could see both of those?
I'd be happy to modify the amendment, the motion to ask for both. It's reasonable.
Any other discussion?
There'd need to be a second on that.
Is there a second?
Second.
And we have to vote on the amendment, is that right? Yep. Any discussion on the amendment? Roll call vote, please.
Yes.
Preston?
Yes.
Gehrig?
No.
Pepcorn?
No.
Mahoney?
Yes. Now on the motion to draft an ordinance, and as my understanding, this is not a mandate today. This is just a motion to draft an ordinance and look at it.
Exactly.
Roll call vote.
Strand?
Yes.
Preston?
Yes.
Gehrig?
No.
Pepcorn?
No.
Mahoney?
Yes. We'll take a 5-minute break and then we'll come back. We'll bring the meeting back to order. As you can see, City Hall has never had so much dialogue. It's kind of nice to listen to that.
Yeah.
We're getting some interesting views. Our next census is Census 2020 update. Donald Kress to explain.
Good evening, Commissioners. Donald Kress with the Department of Planning and Development. Tonight I'll be presenting an update on the U.S. Census. There is no item on this in your packet, so you're not missing anything. Commissioners, as you know, the U.S. Census is conducted every 10 years, and 2020 is a census year. Do you want me to wait a minute, sir? 2020 is a census year. To give some historical context on Fargo's population, our population in 2010 was 105,549. The census does estimates between the censuses. In 2019, our estimated population was 124,091, an increase of over 19,000 people in 9 years. And of course, in 2020, what's it going to be? It's probably going to be bigger still. I don't think we've lost any population here. The goal of the census is to get a complete count of everyone in the U.S. There are two parts to this count. There's the self-response and the non-response follow-up. The self-response is the one you're all familiar with, where individuals respond to the census. Now you can do it online, which is where most responses have come from this year. You can still do it by phone and on paper if you prefer that. And the non-response follow-up, which is done by census temporary employees. Between the two methods, the entire population gets counted. Just a word on that non-response follow-up. This is the door knocking part of the census. The enumerators are temporary census employees hired and trained by the U.S. Census Bureau. They're just going to ask you the same questions that are on the census form. So our current rates as of Sunday was our self-response rate for Fargo is 67.8, which is actually up slightly from earlier in the week. The non-response follow-up is 96.8% complete statewide. They don't break that down by city. It's so we're not doing too badly here. The important thing to remember here is, as the mayor stated in an earlier message at the beginning of our meeting, that Wednesday, September 30th is the last day to self-respond and the last day of non-response follow-up. How can you participate? Yes, Jane, you can still participate. It's still important to participate. There's 3 things you can do. If you've not completed your census form or been contacted by a census enumerator, you can still fill out the form. If you've been contacted by an enumerator, please take the time to talk to that person. And if you're not home, the enumerator leaves a note on your door. They have an official census sticky note there. Please take time to contact your enumerator. As you know, we've had many partners in our outreach. Here's an example of one event, or actually a series of events that's coming up here this week yet to get out the count event here, sponsored by the FM Homeless Coalition. As you mentioned, Mayor, we've also had a press release recently, and city staff appeared on the KFGO afternoon radio show there, doing a pitch for the census here on Friday. So, and we'll go back one. And so that's the count part update. We also, when we were asked to do this, had a general question on how much federal funding does Fargo get? Because, Mayor, as you mentioned, the federal funding is distributed largely based on the census. These are just some general large-scale numbers here provided by our finance office. It's about $50 million a year. There's a couple of disclaimers on the bottom there, since 2020 is maybe an anomalous year. So that census website, census 2020. Oh, there should be an S in there, sorry. Census.gov, and that concludes staff's presentation. Thank you, Commissioners.
Any question by the Commissioners? Commissioner Preston.
Donald, I've been curious ever since I started seeing these numbers, response numbers. Do you happen to know what the response rate was back in the 2010?
You know that number? I don't know, ma'am. You'd think I'd know them all, but that's the one I don't have.
Okay.
I think generally we've been around the 70% ratio. So, we've still got time to, like I said, this was even up a little bit last week. So our final push here will probably bring us up a few more points.
Do you know what it compares to other states?
We are above the state and national average.
Okay.
Mr. Strand.
Thank you, Mayor. Donald, what would be our optimum result?
Well, I suppose it's possible to try to shoot for 100% response rate, but those are hard to get. There's couple small towns that have that, one of which is North River, North Dakota, by the way. Their population is under 100. So,
John, do you know somebody from North River? You know somebody from everywhere.
yeah,
Okay.
okay. Well, I thought you might, so I brought that up.
It shows up on my GPS all the time.
So we respect our folks there in North River. We're doing pretty good at this rate, I'm told by the census folks. We'd like to maybe get in the 70s, which is a little more realistic. A city this size with all the things we have here, including the university, probably the 70s is probably where we're going to be. This is the first time I've ever worked a census like this, Commissioner, so I'm just kind of going off what the census folks and some others who've been involved in this tell me.
Any other questions? Thank you, Donald. Get out there and get those people signed up.
Yes, sir. Thank you.
37, you have my 2020 City of Fargo budget and proposed tax levies. I present them tonight for your final approval. Do I have a motion?
It's a move.
Is there a second?
Second.
Any discussion? Commissioner Garrick.
Shocking, I know. There's a lot to like in this budget. As when you presented it at the brown bag, I told you that there was a lot of things that I liked. Since talking with you, nothing has changed, and I said that I would be for this if a few things changed and a few things didn't change. So I just want to point out what those things were. Like we talked about at the brown bag, we're raising utility rates in a lot of different areas, which indicates to the taxpayer that we're not taking enough money to run those utilities. But that's not what we're doing. We're taking the money. We're asking for more dollars for, say, the drop fees at the landfill. And then we're taking that money and we're moving it out into the general fund or other places in order to fund other things not relating to that utility. That has nothing to do with the directors and things like that. That is something that we have asked them to do in order to fund other parts of the government. So in my mind, it's dishonest to ask the taxpayer to raise your utility rates, which we are all told is for fee for service, and we're using that money elsewhere. So that's something that we've been doing for many years that I think needs to slow and then end. The Art and Social Services Fund, $500,000. I've been opposed to this for a very long time, but especially in a time frame like COVID, in 2020 here, while people are out there hurting, and we are asking people to pay their taxes, and then we take those tax dollars, in some cases, and redistribute it to charities of our choice. It goes to good places. It goes to Food Bank, YWCA, other places like that. It also goes to fund art in the community. But those are charities. And if you're going to ask people to give their tax dollars that they think is going for policemen and firemen and water and sewer, and you take those dollars and you redistribute them to places where they would have no idea where it's going. Maybe they have a charity that they like. I talk about the Autism Center, things like that, things that I support. Allow me to use my dollars as charity and not tax me so that we can act like we're good people by taking your dollar and giving it to somebody else. That's not a good thing to do. Over the last 5 years, we've seen double-digit increases in our valuations here in Fargo, from both new construction and existing. If you own a home in Fargo, you know your value has gone up pretty significantly. 2015, it was 13%. 2016, it was a 12% increase. We've had 5, 6, 7% increases ever since. We're talking a 50% increase in Fargo's value over the last 5 years. However, the mills have stayed the same, barely gone down in those last 5 years. So we're taking in millions and millions of dollars more through property taxes than we were previously, because we can say, hey, we didn't raise your taxes, we didn't raise the mills, but there's two portions, your mills and then your valuation. If your valuation skyrockets and we leave the mills the same, your taxes just went up. So again, in this time, when people are hurting, maybe people lost their job, maybe their property that they own for a business has gone up in value, they're paying more in taxes, but they're not bringing any more business. And we're asking for more money from those folks because their valuation went up. We need to correct that and lower the mills. Creating new funds and moving it out of the general fund. I understand the need for it. I understand what we're doing, but I don't think most people in Fargo know what we're doing. We have a general fund, and out of the general fund, we do a lot of business out of there. Recently, in the last few years, we've taken bits and pieces from the general fund and created new funds. $4 million here, $5 million there. And then we look at the general fund and say, look, the general fund went down. Well, it didn't go down. We just moved those dollars from one fund to a different fund, which made it look like the general fund's going down, and then we increase the general fund and say, oh, it only went up 2% this year. When in actuality, in many years, it goes up by 10, 15%, which is a huge increase in 1 year for any fund to go up that much. So I understand the need for it. We need more transparency in that, and we need to compare apples to apples when we talk to the public about what the general fund is doing. Hey, Last year it was $100 million. Now it's 102, but we moved $4 million from here into a different fund. And therefore, if you put them all together, that's the total number. We're not doing that. So these are the reasons why I'm voting against this. It's the same reasons I voted against previous budgets. But I think we can do better, especially given the times. And our budget is still increasing a significant amount, despite the fact that most people in our community have had some sort of effects from this. And I think we need to do better to lower people's property taxes, lower people's special assessments, things like that.
Any other discussion? Commissioner Strand.
Thank you, Mayor Mahoney. There's one reservation I have about this budget that we're just, in my opinion, stuck with. And that is that we don't have a COLA offering of salary increases to our people. We have the steps and lanes, but we don't have a cost of living increase. The trade-off to that is we're not also laying people off, and we're not pulling in our belts to the point where we're cutting services. But I sincerely believe that our folks who aren't getting that COLA, especially in light of increased healthcare costs, they're going to feel it. And the community needs to know they're going to be sacrificing this next year, going into this budget cycle with a tightened belt, with us pulling in our expenditures and not giving them that COLA increase. So I just want to acknowledge that. If I had a magic wand, I absolutely would fight to give them that cost of living increase because they deserve it.
You can vote no.
I'm not voting no.
And Commissioner Strand, we'll look at the COLA next year. Yeah, we may have better economics, and we'll take a look at that. Any other comments? Roll call vote, please.
Pepcorn?
Aye.
Preston?
Aye.
Garrig?
No.
Strand?
Yes.
Mahoney?
Aye. Appointment to the Housing and Development Authority. You have my recommendations. Do I have a motion?
So moved.
Is there a second?
Second.
Any discussion? Roll call vote, please.
Strand?
Yes.
Garrig?
Yes.
Pepcorn?
Aye.
Preston?
Aye.
Mahoney?
Aye. Applications for property tax exemptions for improvements made on buildings. Do I have a motion?
I so move.
Is there a second?
Second.
Moved and seconded. Any discussion? Roll call vote.
Pepcorn?
Aye.
Garrig?
Yes.
Preston?
Aye.
Strand?
Yes.
Mahoney?
Aye. Recommendation for approval of the 76th Avenue South Corridor Study. Is there anybody to present this, or is it just a recommendation that we approve?
Was this
Bruce, is it just a recommendation to approve?
What's that?
It's been tabled.
Yeah, it's been pulled.
Oh, tabled, I'm sorry.
I'll make a motion to table it.
Is there a second?
Second.
A roll call vote, please.
Pepcorn?
Aye.
Garrig?
Yes.
Preston?
Aye.
Strand?
Yes.
Mahoney?
Aye. Now, Kimber, I'm a little confused because we have another resident comment time, which is this time. And
Mr. Chairman, can I give you a compliment? I just want to say that I think having these additional times for comments is awesome. I think it takes more time for our city commission to be here, but that's our job. And I think both sides of every issue, it's awesome to have them have an opportunity. And I do think it gives our bosses a good feeling when they know that they're being heard. And so thank you very much. This wasn't done until you did it. So thank you very much. I appreciate your leadership.
well, thank you. Does make the meetings longer, but we get more input, which we all like. So Arden Light is first.
My name is Arden Light. My pronouns are he, they. I just have one quick comment on the discussion about masks. As a suicide attempt survivor and someone who has lost family to suicide, I just want to say how absolutely disgusting I think it is that multiple people use the suicide of a young child in their argument against masks. No one can speculate, especially people who don't know this child, why they felt that their life was hurting those around them so much that the only option was for them to die. And I'm really sorry to the family of that child that has to listen to their child's death be weaponized in order to put other people's lives at risk. It's extremely disrespectful and insensitive, and I'm not going to sit here and listen to people weaponize a child's death and not say something.
Richelle Labor.
Good afternoon, everyone. Can you guys hear me?
Yep.
Good. Okay. Good afternoon, everyone. I just wanted to like listen to everything before I go ahead and talk about the mask. I know that commentary is kind of over, but I just wanted to process everything. I do want to commend Mr. Strand for his hard work and the information he brought forward to us. I just wanted to go ahead and piggyback off of what Arden said, and he makes a great point. I too want to extend my apology and condolences to that poor family, to see that once again people are using a tragic situation to further their own agenda is beyond disgusting and very disheartening to see that the length in which we'll go as individuals to get our point across. So I do want to extend that apology. Secondly, I want to say, if we're saying that we don't need a mask mandate and that all we need is just we as an individual can make that call ourselves, then why aren't we doing it? That's my question. And why is it so hard to just do it? Just put the mask on if we are grown adults who are going to be able to take charge of our individual life. We have kids and adults and elderly, and the numbers is going up. Research is showing, and we are being ignorant to the fact that our individual selfish decision is affecting someone who don't have that opportunity to make that decision on their own. So that is just my intake on all of that. Thank you, guys.
Thank you. Christine Soul is our last speaker of the night.
Hi, I'm Kristen Soul. Somebody had asked earlier, where was the power that the state has, or where's the constitutional right that the state has to mandate the masks? Well, that was actually decided in the Supreme Court in 1904, I believe, in Jacobson versus Massachusetts. They found that the police power of a state must be held to embrace at least such reasonable regulations established directly by legislative enactment to protect public health and safety. Ideally, this one was over a smallpox vaccine in order to protect the public health. This is a public health issue. And when you're getting 80% response saying we don't want to wear masks, and when that affects still 20% of the population of Fargo, it still is an issue for the rest of us. And it causes it's a disease that causes horrible lingering issues. And we know that masks work. We have precedent in the pandemic from 1918. We know that there is a second wave coming. This is still the result of our first wave right now. We haven't hit our second wave. And when the second wave hit in the 1918 pandemic, there was 195,000 deaths in the US in the month of October alone. That was 30%, almost 30% of the entire deaths in the US from the Spanish flu pandemic. We're heading in a similar direction, but with a much larger population compared to that time. We know what we have to do. We can speculate what could happen based off of what happened in the past. They did the exact same thing. People did not want to wear masks. There were anti-masker leagues during the 1918 pandemic. We can't go the same direction that happened. Thank you.
Thank you, and thank you for doing the research. We have one more speaker. Okay, what's your name?
My name is Henry Gipp.
Okay.
I'm Papa Dakota. I'm indigenous from Standing Rock Nation. I'm here to speak. I feel the need to speak this time. I've been here consistently within the last 2+ months. I know I recognize everybody. I talked to you, Mayor, on one occasion, Strand. One of the reasons I'm up here is to address the police, specifically North Dakota in general, but this does affect Fargo, right? because of what happened on May 30th, what happened with the police department and protesters that day, and what happened subsequently. Mainly, I want to address, because a lot of people seem to forget, because it gets, swept under the rug in the mainstream media, is the former deputy chief, Osmondson. His remarks, his personal emails regarding racism in the police force. He was a veteran of the police force for 31 years before he was forced to resign. With his comments and his personal emails to his fellow police officers, which were leaked to the media, which we all kind of seem to forget. I haven't, because those things mean so much, especially to a veteran of the police force in the biggest city in North Dakota, in this whole region. And because of what happened on May 30th, and the next day, and the next day, and the week after, and what continues to happen across this nation. So my main thing is, because of those comments that he made, that comes into that brings up so many issues that it seems like, Mr. Mayor, you ignore them. Do you remember the emails I'm talking about, when he specifically said that the way he treated black men in a nice car, the way he looked at them, the way, just 1 second, I'm asking for 1 more second, for the way he treated Native Americans when they were arrested, specifically an extra twist on the cuffs. That is just the tip of the iceberg of what really goes on in the streets and how people of color are treated. So
Mr. Chairman, I move to adjourn.
With what I said here,
No,
I want to make sure.
Your time's up.
I know, but
Time's
I want to
up.
make sure that these things are addressed.
Before I hear you, new police chief is going to address many of those issues. And as you know, Osmondson had a variety of things today and don't normally get in dialogue. But police chief coming in has offered to meet with everybody. We'll sit down and talk and see what we can do. Do you have a motion to adjourn? Is there a second? All those in favor say aye. Aye. We're adjourned. Thank you.